Hi, this is Dr. Nisha Vishnu. This video is for those who has been prescribed intracavitary brachytherapy after the completion of their external radiation for their cancer and are perplexed about it. Small suggestion, please see part 1 of this video series where I explain brachytherapy in general. The link of that will be shared in the description. So, in our clinics, most commonly it is done for cancer of the cervix, the second most common female cancer in our country. Cervix is the mouth of the uterus. The part below the cervix is the vagina. So, vagina followed by cervix and the uterus above it. If you look at it, it is a intracavitary. As the name indicates, the radioactive source goes into this cavity, stay there for some time and comes out of the body. During the time it remains in the cavity, it deposits its energy into the cancer cells and kills them. Lot of my patients are tired by the end of the external radiotherapy and negotiate like a pro to discount them from this treatment. Let me tell you that this technique makes a huge difference in the final outcome of the treatment and hence should not be avoided at any cost out of fear or any other reason. What we do in intracavitary brachytherapy is that we place an applicator, which are usually three hollow, blunt but sturdy pipes. The first pipe is known as the tandem and it goes into your uterus. Second and the third pipes have small ovoid egg-like structures attached to it and goes and fits into the groove between the vagina and the cervix. I prefer to give a spinal anesthesia to my patients so that the process of dilating and putting the applicators is not very painful, and also while you are relaxed, we are able to achieve better application. Once this applicator is inside the cavity, we pack your vagina tightly with gauze packs. And then the applicator will be secured in position by tying it. This procedure is done in our operation theatre, observing perfectly sterile environment. Once applicator is in place, we shift you to our scanning room and take a CT scan. Once CT scan is done, you will be shifted to our brachytherapy room. While you are being shifted, we, that is your radiation oncologist and the physicist team, will plan your brachytherapy on the CT scan just acquired. That is, at what distance and how much time should a radioactive source dwell in a particular point so that a good dose is dumped in the tumor area and minimum dose goes into your urinary bladder and rectum. After we obtain a good plan, this plan is fed into the brachytherapy machine. This is how a high dose rate or HDR brachytherapy machine looks like. Till now, radioactive source has not entered into your body. It is stored in the HDR machine safely. Once we connect the HDR machine to your applicator and switch the machine on, then the source will flow through the hollow tubes or applicator inside your body, stop over for the exact amount of time as per our plan, and flow back into the machine after the treatment completion. The whole treatment might take anywhere from 5 to 45 minutes. Once the whole process is over, we remove the packs from the vagina and then remove all the tubes inside you one by one. Depending upon how long the procedure lasts and your anesthesia wearing effects, you might feel some stretching discomfort or pain in your vagina or lower part of the tummy. Oh, I forgot to add that we put a Foley's catheter or a small pipe into your urinary bladder during the procedure in the operation theatre itself. That is a pipe to drain your urine during the process, which will be removed once the procedure is complete. The whole process is half a day procedure and will be done either under ward admission or daycare. On the morning of your treatment, we would have given you some pre-medications and also an enema to clean your bowel. You will be advised not to eat anything until and after 4 to 6 hours after we finish the process in case anesthesia is involved. The day prior, you would have met your anesthesia team and got a pre-anesthetic clearance after a small gamut of blood tests, chest X-ray and ECG, plus minus some more specific tests as required and as advised by your treating team. After the entire process, depending upon your condition, we might discharge you with some symptomatic medications and or we might observe you for a day. Usually, we perform 2 to 3 such brachytherapy sessions with a usual gap of 1 week between 2 consecutive sessions. That's it for intracavity brachytherapy. If you want to learn more about other brachytherapy techniques, please hop on to my next video. Thank you.